question, you can punt it to another week, but just about just duration and timing of everything, because some of the things seem fundamental to who you are. For instance, if you're seeing an acupuncture, you're being treated for a long time, how drastically do things change from week to week or month to month, and how much it, obviously you get a common cold or something, that's one thing, but overwhelming, how much of a shift do you really see? I don't know.
No, that makes perfect sense. It depends on the nature of the disease. The more acute something is, the quicker it'll go away. Stomach fire is an excessive condition, okay? It'll go away quicker. Whereas a deficiency will tend to take longer. The deeper the deficiency, the longer it takes to heal, in general. So, for my stomach fire diagnosis and the acne, it took about 3 months to be 90% complete, 90% gone. That's pretty quick.
And then does she continue to treat you for that in some capacity, or is it then shifting to other parts that might be out of balance? I mean, like,
yeah.
How do you then, I could just think you could fall into patterns with your provider that how you were in the past, but then look at who you are today and having very different patterns.
Yeah. So what'll happen is what'll tend to happen is be like, oh great, I'm doing so much better with this. I've got this going on too. Can you help me with that?
Right.
Yeah. So then you start to shift. You don't forget about what was there. You still take care, make sure it doesn't come back, but then you start to shift the focus. Yeah.
I guess then, in addition to that, at what point do you know it's not working?
A lot of people will give up too quick. A lot of people will want a quick fix because we're in a Western culture, right? We're used to taking a pharmaceutical, taking something over the counter, and you want that like quick, I'm done, good, my symptoms are gone. It's not Chinese medicine, right? We're treating the actual root cause, not just masking the symptoms. So a lot of times people will quit too soon. I had one teacher a long time ago who would say, you take how long you've had that disease, cut that in by a third, that's about how long it'll take. Which is just a big generality, and you're really saying that so that people don't give up too quick. Everybody will respond differently. Depends how strong a dosage you give. You have to be careful. If you change things too quick, it can cause damage, right? If you tonify too much yang, you set the house on fire instead of having a nice little small yang fire to slowly warm them up. Does that answer your question? Yeah, sort of.
Sort of.
Ask me more so that I can make sure I answer it.
I guess it would be, at what point would you think that you would go an alternative route for care?
If you feel like you're not getting results, again, it'll depend on how long you've had the disease and how long. But your acupuncture should say, hey, we're not getting very far with this. We may want to try something else, right? Because first and foremost, it's not about making money. Yeah. Yes, we have to make money. We have to, right? That's part of life. But it's about making sure you're getting the best care possible. Yeah. So when to refer out. Yeah. Whether that's to another acupuncturist, an herbalist, who's more specialized in that field, or if it's to a naturopath, an MD, whatever it is. Yeah. I refer out to MDs fairly often. You have to get this checked by an MD. Yeah. I won't even treat you unless you get this checked out. Good. Then there's other times where I'll treat you and you need to go to an MD, right? Because it's not as like possibly serious.